So the current trend in obesity in our nation is definitely on the rise. It doesn't seem like it's going to stop anytime soon, but the current trend is clearly that obesity is on the rise. And what we're seeing is that individuals are becoming morbidly obese at a younger age. And that's very dangerous, very scary, and the younger we can make a difference in someone's lives, the better. So the way we typically look at how someone is a candidate for obesity surgery is by calculating their body mass index. What the body mass index is fairly simple. We measure your weight and divide it by your height, and that gives us a ratio that helps us figure out if your weight to height is over what it should be and if you are a candidate for obesity surgery. And basically, a normal BMI is between 18 and 25. An individual that's overweight is between 25 to 30. Over 30, we say that individuals are obese, and over 40, morbidly obese. Now, there is a category of people with their BMI between 35 and 40 that can qualify for weight loss surgery if they have two medical comorbidities that are clearly related to their obesity. So when we talk about a comorbidity, we talk about a condition caused by an individual's weight because of their obesity. When we talk about comorbidities that are clearly related to obesity, we talk about diseases associated with obesity, such as hypertension, which is clearly related to obesity. Hypertension or high blood pressure has a direct link to an individual's weight. When we talk about hyperlipidemia or high content of fat in the blood, which is a risk factor for cardiovascular disease or heart disease, that's clearly related to an individual's weight. When we look at cardiac disease, that seems to be clearly related to obesity. That's another comorbid condition caused by obesity. Sleep apnea is another one that has a direct link to morbid obesity. So those are the conditions related to obesity that we are talking about. Sleep apnea is when there's different conditions that can cause sleep apnea, different mechanisms that cause sleep apnea, but basically how we should think of sleep apnea, and usually what obesity causes, is obstructive sleep apnea. So in other ways, the throat or the tissues around the neck in a morbidly obese individual become very heavy, and as we're trying to sleep, laying on our back, sides, however you sleep, that pressure obstructs the airway because there's too much weight and too much pressure. We clearly see more diabetes in the obese population, and that is probably one of the comorbid conditions with which we can make the biggest difference in an individual's life. Is after morbid obesity surgery, the reduction in diabetes is phenomenal. Depending on who you read, anywhere from 60% to 90% of individuals will have complete resolution of their diabetes. Now, that diabetes can go away for a period of time and come back after a while, but it's different for every individual. But in a very large percentage of individuals, we can cure diabetes. So the correlation between cancer and morbid obesity, we're finding out every day that the two are clearly linked. So far, we've been able to identify that breast cancer and colon cancer, amongst others, are clearly related to obesity. So not only are we making a difference in those comorbid conditions that we've talked about, but I think potentially we're going to find out that by reducing a patient's weight, helping them with their morbid obesity, we're also going to decrease their risk of developing a cancer later on tremendously. So, as we talked about before, the way we look at a patient to see if they qualify for obesity surgery is to look at their body mass index, or their BMI. So if a patient's BMI is over 40, they qualify regardless of their comorbid conditions for obesity surgery. If a patient's BMI is between 35 to 39 and they have at least 2 comorbid conditions related to obesity, they also qualify for surgery. And those comorbid conditions are conditions that we talked about, such as obstructive sleep apnea, high blood pressure, cardiac disease, hyperlipidemia, amongst others. There is now an approval for patients with a BMI between 30 and 35 with diabetes or comorbid conditions for a laparoscopically placed gastric band. And that's an indication for patients with a BMI between 30 and 35.